Hello, welcome to VMC. I'm Dr. M. Today we are going to learn the top tips you can use to become what we call in the veterinary world a unicorn client. Join me, you'll learn something. So these people are called unicorn clients because they are so rare they almost seem fictional and unbelievable. And you want to be a unicorn client because it will make life for your vet clinic easier and it will help you get the best care possible for your pets. The first thing would be to make sure that you keep up on preventive medicine. This means things like vaccines, heartworm prevention, flea prevention, tick prevention, deworming. This also means dental care. Keeping up on all of the preventive care will reduce the likelihood that your pet will need to see us for other care. The second thing I will mention is that if you notice changes with your pets, be proactive about this. Don't wait until your dog or cat or horse or any animal is incredibly ill and sick before seeking veterinary care. We can often do a lot more to treat and help and fix an animal before they get severely ill. So do not delay care, and if the initial round of physical exam and history taking doesn't really show much, then be persistent. Start to pursue some diagnostic tests to get to the bottom of what's bothering your pet. Third, please be transparent about budget. We will not judge you. We just need to know what it is so that we can work with you within that budget. It truly is a fantastic idea for most people to have pet insurance. I have pet insurance for my pets. My dog is currently needing a scope for her elbow. I'm already $3,000 into just the diagnostic workup, x-rays, blood work panels, CT, seeing the orthopedic specialist, and we haven't even treated the problem in her elbow yet. If I didn't have pet insurance, I wouldn't be able to afford all of this, and I know that that is the case for many people. So please talk to your veterinarian about pet insurance. If pet insurance isn't something that you're interested in, I would recommend that you have a pet fund that has at least $10,000 in it. If you ever remove any money from that fund, you have to immediately fill it back up again. This is because pets don't necessarily just have one issue and then wait for a while for you to get more money back into your fund before having another issue. So you really need to have an easily replaceable $10,000 fund that you can just draw from at a moment's notice if you don't have pet insurance. I recognize that there are going to be people who are unable to do either of those things. And I've been there. When I was a student, I had an extremely strict budget. What's important to recognize is that this can mean your pet does not receive the ivory tower Cadillac best practices medicine. And you have to acknowledge those risks and you have to be okay with them. Your veterinarian will offer the best that they're able to with the information they have within your budget, but there are going to be more risks to this and it may not be as successful. But trying something gives the pet a chance, and if it is not successful, then we need to discuss euthanasia. That is the other thing. There are going to be some medical issues, like say a gastric dilatation volvulus. The only treatment option there is surgical. And if you are not able to afford that surgery, then you need to be discussing euthanasia with your veterinarian. And in these cases, you cannot blame the veterinary clinic. They are simply offering the best that they can with the constraints of the budget that they're working within. Running a vet clinic is exceptionally expensive. There is so much overhead. The machines cost so much money. We also have to be able to pay staff. And so as much as we wish that healthcare for pets was free, it's not. Even if there are no budgetary constraints, there are going to be times where euthanasia is simply in the best interest of the animal. I know that those are very difficult situations and it's very emotional and hard to go through. Your veterinarian will support you as best as they can, and please remember to be kind to them. They are simply trying to help you and help your pet to the very best of their ability. That does kind of nicely lead into the next point. Please do not engage in the cyberbullying that occurs on a regular basis. So many of us have gone through it, and often what is reported in the news is very one-sided or doesn't actually understand the intricacies of medicine as a whole. I did do a video on that dog Jax from a while ago. I'll link it in the video description, where that clinic was just blasted on social media and they received death threats and bomb threats, and they had to have police officers to keep their staff safe, as there were threats towards the staff and towards the building and even the family of the staff. This is not okay, and engaging with that type of media does not help anybody. We are already incredibly understaffed and overworked. Adding to that burden just means that fewer pets get the care they need. If that was part A of this point, part B is that if you do have a good relationship with your veterinarian, consider writing a nice review on some online forum of some sort. If you feel up to it and if you have a good relationship, writing a nice review can very much make the entire day for that vet clinic. It really means so much to us, and it makes all the effort we put in a little bit more worthwhile. The next point is please, 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 I beg of you, be a little bit early, like 5 minutes, or at the very latest, be on time to your appointment. These appointments are scheduled very tight. We're often completely booked out for weeks in advance. And when someone shows up late, that will push everybody else and everything else late. So if you are not going to be there on time, call your vet clinic and reschedule. Then we can get someone else into that time slot, or we can just move on with our day, see the next person who will hopefully have shown up just a little bit early for their scheduled appointment time. Now, I recognize that this is a bit of an ask because there are times where I'm running behind. I hate it when that happens. Unfortunately, it happens semi-regularly, and I really apologize to everybody when it does happen, but it always happens for a very good reason. Like, I had one patient come in to recheck a chronic eye issue. I ended up feeling that the dog had huge lymph nodes over its whole body. We ended up diagnosing lymphoma, which is a cancer type, and that was actually why the dog wasn't doing very well. It wasn't the eye problem after all. And so this appointment that's supposed to be a 15-minute recheck an eyeball turns into this entire, are you going to pursue seeing a veterinary oncologist? Are you not going to? If you're not going to, we need to start this treatment right away. Oh, okay, there's budget concerns. Then we also need to consider discussing euthanasia because the dog's already not doing well. And to throw into the entire mix, this dog was that person's mother's dog, and she had passed away recently, and so there was a lot of grief and loss tied up, with this dog. And so it becomes this huge, long appointment, and I couldn't foresee that. This isn't a fault of reception for not booking it properly, but we just have these sorts of things happen all the time. Or we'll be in the middle of appointments and a hit by car animal gets brought in, or animal control comes with some dogs that were loose and in a dog fight, and then all of a sudden we're trying to stabilize and save a life when we have a fully booked appointment schedule, but we had no way to foresee these emergencies coming in. And so if I'm ever running late, please be patient and understanding. If you cannot wait, just say to the front desk, look, I can't wait today. Can I please book an appointment for another day? I'm truly doing my best and triaging and treating as many patients as I possibly can while making sure that the most critical ones are seen and attended to. And then the thing to remember, if you're ever in this situation and it's frustrating, just remember that when the day comes that your pet needs the extra time, I'll spend it with you, and we will be making other people wait. So having the patience and being reasonable goes an incredibly long way. The next thing to help you become a unicorn client for your vet clinic is to please communicate within the family of the people who have interactions with the animal being treated. It frequently sucks up so much of my time when someone comes in who doesn't know enough information about why the pet needs to be seen or why they're there, and then I do my best and get the pet on the way, only to have someone else from the family call the clinic later and yell at reception and be angry because we didn't do what they thought the pet needed, but none of that was ever communicated to us, and we can't read minds. And so the person who comes to the clinic needs to have all the information about the pet. Like, there's no way around that. And also, when we're having a conversation about a treatment plan, I cannot have that exact same conversation with 5 different people at 5 different times. If there are multiple people who want to hear it from me and to be able to ask questions, everybody needs to be at the appointment, or we need to do like a group phone call where we can just go over everything once. The second to last note that will help you with being a unicorn client is really just to be reasonable. You're a human, we understand that. We are also human. Please understand that too. There's lots of very charged and emotional things that happen in vet clinics, and being a reasonable human being and being understanding that life isn't perfect goes such a long way. I mean, of course, in any industry there can be a few bad apples, and vet med is not exempt from that, but the vast majority of us truly are doing our best. And it's an incredibly challenging field because our patients can't explain to us what's going on, and this is medicine. Medicine is not perfect. There are risks to the things we do. We will recommend the treatment options because those risks are lower than the risks of not treating, but that doesn't mean that everything's going to go perfectly every time. And there can be serious side effects, there can be serious complications. If you have questions about those things, don't ever hesitate to ask. We're happy to explain them to you, but just always know that truly we are doing our best, and when something doesn't go perfectly textbook, we are devastated by it. It is awful, and we grieve and we hate it, and it hurts, and we know that it hurts you as well. And if you ever need a second opinion, don't ever hesitate to do that. Sometimes we're having a fresh set of eyes or someone with a different set of skills like a specialist. Those sorts of consults can be incredibly helpful, and you should always feel free to do them. All I want is for your pet to do the best possible, so I will facilitate whatever I can to make that happen. And the last thing that unicorn clients do is they say thank you. And saying thank you, writing a little card. A lot of veterinarians, myself included, we keep those cards and we read them on the really bad days. So if you ever have a time where your veterinarian has helped you out, don't hesitate to say thank you. We don't hear it that often, and it means so much when we do. Some people will drop off some flowers. That's also lovely. Other people will sometimes drop off food or coffee. Those things can also be huge for vet clinics. We often don't get breaks for lunch. There's times we don't even get breaks to pee for hours and hours and hours and hours, and it's not okay because it's contributing to the burnout in the profession. But just keep in mind that your vet clinic likely does not take any breaks the entire time they are there. And so if you are going to drop off food, consider something like a veggie tray where you can just grab a carrot and eat it as you keep walking, or a fruit tray, just something that can be at room temperature and can sit on a counter somewhere and that people can just grab a bite as they walk by it. None of those sorts of things are at all expected or necessary. Truly, a verbal thank you or a card or a review, those sorts of thanks are valued and treasured. Really, this entire list is basic things, but they're rare. Very few people treat us with the courtesy of the things I've outlined in this video. In the comment section, please tell me what you've learned that you're going to implement in order to be a unicorn client for your vet clinic. Or feel free to practice writing a review by leaving feedback for me about this channel. I always find this very valuable as I want to make videos that better support what you need and the information that you're looking for. So if you have future topics you want me to cover, feel free to leave those suggestions down below too. I do make a new video most Fridays, so I look forward to seeing you then. Bye!